Are you experiencing pain on the side of your hip, especially around the bony part here, making daily activities like walking, running, or even lying down painful? You might have hip tendonitis. My name is Faris Solomon. I got my degree in the study of human movement, and I'll go over why this happens, common causes, and most importantly, a structured rehab program to help treat it. Let's go. Hip tendonitis refers to inflammation or irritation of the tendons that attach muscles to the greater trochanter, which is a bony prominence on the outer femur. The tendons that are usually the most affected are for the gluteus minimus and gluteus medius muscles, which are key structures that help maintain hip stability. When these tendons are overused or when there is poor movement mechanics, tiny micro tears can happen, which can cause pain and discomfort. Without proper recovery, these micro tears can add up, affecting the structure of the tendon itself, and that's why strengthening the surrounding muscles and improving movement mechanics helps reduce the stress of the tendons to promote healing and recovery. As for the most common causes of hip tendonitis, first, repetitive movements like running, walking, or even stair climbing without enough strength training, which overloads the tendons. Second, weak glute muscles, which can cause their tendons to absorb more stress, leading to inflammation. Third, tight hip flexors or IT band irritation, which increases the strain on the tendons. Fourth, poor movement mechanics, for example walking with excessive hip drop or inward knee collapse, which can overstress the hip tendons. Fifth, sudden activity changes, for example increasing the intensity of your workout too quickly without giving your muscles enough time to adapt. Now that the common causes have been identified, the exercise program will have three key phases. The first will be to reduce pain, the second will be to increase the strength of the surrounding muscles, and the third will be to add functional exercises to help you return to your daily activities. Let's get started. The first exercise is a supine glute stretch. Lie on your back with the band looped around the affected foot. Slowly pull the band to lift your leg up while keeping it straight. Then pull your leg across your body until you feel a stretch in your glutes. Hold that position for 30 seconds. That's one rep, repeated 3 times. This helps lengthen the glutes to relieve tension on the tendons. The second exercise is a ballerina stretch. Stand and cross your unaffected leg in front of your painful one. Move the hip of the affected side outwards and slowly reach with one arm overhead until you feel a stretch along your outer hip, especially the TFL muscle. Hold that position for 3 reps of 30 seconds each. This improves the flexibility in the lateral hip muscles and relieves IT band pain, reducing compression on the tendons. The third exercise is a side-lying hip abduction. Lie on your pain-free side with your bottom leg bent for stability. Slowly lift the top leg while keeping your toes pointing forward and without tilting your hips. Hold that position for 1 to 3 seconds, then go back down. That's 1 rep. Keep going for 3 sets of 12 reps. This strengthens the gluteus medius, improving hip stability. The fourth exercise is clamshells. Lie on your pain-free side with both knees bent and feet together. Slowly lift the top knee while keeping your hips stable. Hold for 1 to 3 seconds, then come back down. You can also make this exercise more challenging by having a resistance band just above your knees. Repeat this motion for 3 sets of 12 reps. This activates the deep hip stabilizers, reducing stress on the tendons. The fifth exercise is single leg deadlifts. Stand on the painful leg with a slight knee bend. Keep your lower back straight and hinge at the hips, lowering your torso as far as you can tolerate without causing pain. Then slowly return to the starting position by engaging your glutes. That's 1 rep. Keep going for 3 sets of 10 reps. This increases hip strength and control, reducing tendon overload. The sixth exercise is crab walk. Place a resistance band just above your knees and go into a mini squat position. Take a step sideways Then follow with your other leg while keeping tension in the band. After a few steps, switch direction to work on your other side. Keep going for 10 steps in each direction. This one set, repeated twice. This builds lateral hip strength and stability, preventing excessive stress on the tendons. To prevent hip tendinitis from reoccurring, first, avoid high-impact activities like running until the pain subsides, but also maintain movement within the pain-free range to prevent stiffness. Second, stay consistent with stretches and mobility work to reduce tension on the tendons while also strengthening the glutes and surrounding muscles to increase hip stability. Third, wear supportive footwear to counter issues with biomechanics. Fourth, listen to your body to notice early signs of discomfort and avoid making the condition worse by adjusting the movements as needed. Fifth, consider ice or heat therapy, which can help with pain relief. Hip tendinitis can be a limiting condition, but with consistent rehab, returning to pain-free movement is within reach. So as always, stay active and mindful.